Successful outcomes using TeamSTEPPS skills in long-term care.
Hi everyone. Today we are at full census with no admissions or discharges expected. Mr. Vega's family will be bringing him to the doctor at 11:30. He'll need a bagged lunch. Alicia, can you call the kitchen and ask for one? Thanks. On the 24-hour report, it was noted that Mrs. Smith was up for most of the night. We'll have to watch her and encourage rest periods.
At handoff this morning, I was told Mrs. Smith was confused last night and was found wandering in another resident's room looking for her bed. I checked on her just now and she's still sleeping, so I didn't wake her.
Let her sleep. Her confusion and wandering is new, so I wonder if she might have an infection brewing. Let's encourage fluids just in case. Okay, now Mr. Steinberg. Lucy, how's Mrs. Smith doing?
Yeah, I wanted to talk to you about her. I've been offering her drinks all morning, but she doesn't want them, and she only ate about 25% of her breakfast, which was weird because pancakes are her favorite. She also seems to be coughing a bit. She definitely isn't herself today.
I agree. Can you go take her vitals? I'll be right in to assess her.
Mrs. Smith didn't have a great day. She isn't eating or drinking well. She only ate 25% of breakfast and half her lunch and refused all extra drinks. She started with a cough and has a bit of a temp, 99, but her vitals are normal. She slept late because she was up wandering last night.
Yeah, I thought she was acting funny today, too. Sorry to interrupt, but I overheard you talking about Mrs. Smith. She refused to go to activities today and didn't engage with me when I did my rounds.
Really? Thanks, Christine. We aren't sure what's going on with her. So the nurses want us to monitor her vitals, encourage fluids, and report any changes or increased confusion.
Mrs. Smith, may I come in? It's time for the music program. You finally get to meet the barbershop quartet from the radio.
I can't go to that. I'm waiting for my husband.
But you love live music. You asked me to come and get you. Mrs. Smith, are you feeling okay? Hey, Carmen, do you have a minute? I was just in with Mrs. Smith. She was pretty out of it.
Yeah, I know. I was told that at report today, but she's doing much better. She ate most of her dinner. She's fine.
Carmen, I'm not sure. I know you're not her usual aide, but something's not right. She thinks her husband is still alive.
Mrs. Smith is just tired. Don't worry.
Carmen, I don't think so. Mrs. Smith wasn't going to miss tonight's music program. She seems confused, not just tired. If you're busy, I can go talk to the nurse if you want.
No, all you have to do is worry about getting the residents to the events. It's my job to figure out if they're getting sick or not.
Hey, Liz, do you have a minute?
Sure, Jen. What's up?
Well, I was just in to see Mrs. Smith and invite her to the music program we've been planning on. She seemed confused and lethargic, even leaning to one side while in her chair. She said she couldn't come because she was waiting for her husband. He's been dead for years, and she knows that. I went to Carmen to tell her my concerns. I even used the 2-challenge rule. She kept insisting that Mrs. Smith was okay, but I don't think so.
Thank you, Jen. We have been watching her all day, and she has been exhibiting some subtle yet concerning changes. I also appreciate you coming to me since your concerns weren't addressed. I will be discussing this with Carmen, but first I'm going to go check on Mrs. Smith. Hi, Dr. Flores. This is Liz James from the Shady Pines Care Center. I'm calling you about Mrs. Mary Smith, 88 years old, has had a change in her condition. She has a new onset of confusion, has developed a cough, and she didn't eat much today. 25% of breakfast, 50% of lunch, 75% of dinner, and she's not taking on any extra fluids. Mrs. Smith has type 2 diabetes, arthritis, osteoporosis, cataracts, stress incontinence, and mild cognitive impairment. She walks with a 4-point cane and is hard of hearing. She is lethargic but responsive to simple verbal commands. She doesn't normally exhibit impaired judgment, but last night was found wandering in other residents' rooms looking for her bed. Her blood sugars and vitals are normal. However, she has been running a temp of 99 since 11 this morning. She has a dry cough, and on auscultation of her lungs, she has some rhonchi in the right base, and her urine looked cloudy. I am wondering if she's starting with a UTI or respiratory infection. I think she's stable to stay here with us, but should we get a urine, chest x-ray, or other lab work?
She may be developing a UTI or URI. Let's get a chest x-ray, UA, CNS, a CBC, and lights. Give acetaminophen for a temperature above 100 and any complaints of pain. If she spikes a temp above 101, call me right away. Encourage fluids, and let's monitor her intake and output for the next 72 hours.
Okay, that was get a chest x-ray, UA, CNS, CBC, and lights. Give acetaminophen for a temperature above 100 or for pain. If she spikes a temp above 101, call you right away. Encourage fluids and monitor her I&O for the next 72 hours, right?
Yes, I will be doing rounds tomorrow, so I will be in to evaluate her then. If anything changes in the meantime, please call me.
Hey, Carmen.
What's up?
I want to talk with you about earlier. I sensed that you were upset with me for expressing my concerns about Mrs. Smith. I wasn't questioning your nursing ability. However, when you ignore my input, it makes me feel as if you don't value my opinion as a member of the care team. I wanted to be sure I communicated my concerns about Mrs. Smith's condition. If you have concerns about my observations, I would appreciate you taking the time to listen first. I'm not a certified caregiver, but I do observe the residents, and my perspective and interaction with them allows me to pick up on changes in their health, too. If you could acknowledge my observations in the future, I'd feel as if I'm a contributing member of the care team.
You're right, Jen. I should have listened to you earlier. This new assignment overwhelmed me, and I took it out on you. We're all a team, and I will take your concerns seriously next time.
Good morning, Gayle.
Hi, Liz. How are you?
I'm glad to see you. I worked a double. But the good thing is I've been on the same unit, so I can update you on Mrs. Smith.
Oh, good.
You know Mrs. Mary Smith in room 152, bed 2?
Yes.
She has a low-grade fever of 99. Her urine was reported cloudy, and her cough remains dry, but she has some rhonchi in her lower right lung. Her vitals and blood sugars are normal. She ate better at dinner, and she is taking on some extra fluids.
Good.
Dr. Flores ordered a chest x-ray and a series of labs for her. She's on acetaminophen, PRN for pain, or for fever greater than 100. We're just awaiting her lab results. They should be here by 11 a.m. Her increased confusion was beyond her normal cognitive impairment, so we thought she might have an infection. However, besides the acetaminophen, there's been no changes in her medication so far.
Okay.
We are encouraging fluids and have her on I&O for the next 72 hours. She seems to like popsicles the best. Dr. Flores will be here this afternoon to examine her. However, if there are any changes at all, call him immediately, or if there's anything outstanding on the lab report. Also, Mrs. Smith's daughter, Diane, has been notified, and her care plan and CNA assignment have been updated.